Hi, my name is Dr. Lillian Perry, and I'm an obstetrics gynecologist, or OBGYN, and am studying to become a fertility doctor. I have been interning at Denton Survival of the Fetus Fertility Clinic for a year. Endometriosis is a fairly common disorder, and I have been treating about 79 patients in the past year that I've been here, and I've had about 800 patients that I've seen. The signs of this include menorrhagia, which is excessive bleeding within the period, metrorrhagia, which is bleeding in between periods, and then cysts in the endometrium tissue within the uterus. The symptoms include dysmenorrhea, which are painful periods, and dyspareunia, which is pain during sex. Though treatment is available, the risks of endometriosis include a slightly higher risk for ovarian cancer, and endometriosis does increase infertility, and it can be difficult to get pregnant if you have this and it's untreated. On March 24th, 2022, a Hispanic 25-year-old woman came into the clinic because she was bleeding between her period. She has been seeing another fertility clinic, and she saw them for about 6 months, but then when the bleeding persisted, she came to see us. She went to the other one because she hadn't been able to get pregnant for over a year of her and her husband trying, and then she came to us because things were just not getting better in the other clinic. She has a family history of endometriosis. Her aunt had endometriosis, but she was never given an ultrasound or a laparoscopy. The other clinic did do a pelvic exam, but unless there are cysts that are formed, the pelvic exam will not help with diagnosing endometriosis. When we went in with our ultrasound about 6 months after they had done the pelvic exam, we did find cysts in the endometrial tissue. We then decided to do a laparoscopy because the patient wanted to become pregnant, so hormone replacement therapy was not an option. So we completed the laparoscopy and removed the cysts and thus treated her endometriosis. The symptoms of this disorder can be alleviated, and it's best when it's diagnosed early. Because there are many different diseases that have similar symptoms like ovarian cysts and pelvic inflammatory disease, or PID, diagnosing endometriosis can be tricky. But there are some indicators like family history and then menstrual trends. If the bleeding is very heavy and lasts for more than 5 or 7 days, then it can be an indicator of endometriosis. And I really implore my fellow health professionals to understand the gravity of this condition and take the signs and symptoms seriously, because again, if you diagnose it early on, then it's the best for the patients. Thank you.